Questions recently on my live Q&A, and people reach out to me in email and says, hey, what do I do in terms of the future? My Social Security check, I hear it's going to be cut 17 to 20% because of the trust fund and the way the Social Security system is set up in terms of it's a pay as you go. And once the trust fund disappears, what's going to happen? Well, we'll talk about that today and what's happening out there. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country, and I've spent a few decades helping millions of people throughout the country make sure they get everything they're entitled to from Social Security, Medicare, Medicaid, and all the rest of it. So let's talk about that today. It shouldn't take that long. The topic of the day take about 10 minutes, and then I'm going to get into Q&A. It looks like we already got some questions there. So if you have any questions about all things Social Security, retirement, disability, uh, spouse benefits, survivor benefits, any of it, just go ahead and click the chat and put it in there. Um, and since this is October and the annual enrollment period is officially upon us, I've got a partner that helps out with Medicare. So if you need Medicare Help, Medicare Advantage, Medicare Supplements, Part D. So if you need to see if you're in the best plan for next year for any of those, make sure you call the number directly. I guess we're having problems on our particular phone line this morning. People are getting dropped. So just go ahead and because you got to make the switch. You have to review your plan. I've talked about this many, many times. You know, Medicare is something you paid into. This is your money. My job is to help you get all your money back. That includes Medicare. So that's why I partner with this organization to help you get all the money you're entitled to. And so those Medicare plans are something you paid into. So let's make sure you get everything back. So just give them a call and they'll help you out. Their help is 100% free. All right. So you've heard about the trust fund running out of money. And that's what the trust fund was designed. It was designed for the baby boomers, 1946 to 1964, 76 million people born during that time. And those people we are getting older. We are getting of that age and we're starting to dip into the trust fund. And by 2034, 2035, that trust fund is going to run out. And that's what it was intended for. Social Security has had many types of trust funds since 1935, and they use it for particular times and they run out. But after that, it's a pay-as-you-go system because there's less people paying in. So there are always going to be people paying into FICA, so it's not going to go bankrupt or anything like that. It's just that the amount being paid in is less than what needs to go out. Demographics, and probably the number one issue is more money is going to the top, to the richest Americans who don't pay into FICA. After, for this year, it's $168,600. After that, they don't pay FICA like the rest of it. So if you make under $168,600, you pay 100% of your pay. Percentage of that goes to Social Security and Medicare. If you make over that amount, you don't pay into the Social Security part anymore. You pay into Medicare, but you don't pay into Social Security. So that was kind of never intended when they made the tweaks back in 1980s. That's why we're having the crisis that we're having now. But what are we looking at in the future of your Social Security check? Well, depends. You read different reports by governmental organizations, anywhere from a 17 to 20% cut in your benefits 2024, 2025 because of that. But I just want to back up a little bit here. There are way too many people losing money right now. And that's my job in my semi-retirement. I retired after Social Security, went back to work about 1 week later, helping people do exactly this, get their money. Too many people now are losing money because they're not getting everything they're entitled to. And so that's why I do the live Q&As. That's why I've got over 800 videos out there to help you. They're filing at the wrong time. They're filing for the wrong benefits at the wrong time. They're filing for benefits, and then a few years later, situation change, and they forget to change benefits or switch benefits. They don't know they can do that. So there's a lot of people making mistakes out there. So that's my job. And with all the new changes, not sure if you heard, but there's a presidential election happening. Seems to be happening for the past 20 years straight. But there's a presidential election, Congress coming in. The Social Security issue definitely needs to be addressed. And with the new president coming in, the new Congress coming in, I'll keep you updated on everything that's going to happen. That way you can plan a bit better for what's going to happen. So I also get a lot of people that are making decisions based on possible futures So they're saying, well, I wanted to wait to file for my retirement benefits until I was my full retirement age, or I wanted to wait till I was 70 so I get those delayed retirement credits. But considering within very short time, 8 years is not very far away, there's might be a 17 to 20% cut. So maybe I should go ahead and start my benefits now, and that way I can get more money, before the cuts happen. So, I mean, that I can't advise you on that particular thing. I'm kind of an optimistic, being an old Marine Corps sergeant, try to, gung ho. Um, I think we can push our politicians to make solutions that won't get us that cut. I've talked about what the solutions are several times, but I'm kind of optimistic in that respect that hopefully politicians do their job and do what we want them to do, is to make sure those cuts don't happen. So, but if you're more on the pessimistic side, which I can see, then it just might be a good idea to go ahead and start your Social Security benefits now. Start getting those benefits as much as you possibly can until that eventually happens. So, but if you're already receiving your Social Security check now, on the horizon, 17 to 20% benefit cuts. How do we stop that? We convince our politicians to do the right thing. There's a lot of politicians that are out there that are just kind of kicking the can down the road and waiting for the true emergency a day before the 20% cuts. And that way they can get the proposal possibly that they really want, was, just hand it over to Wall Street, or, privatize it, or whatever the case may be, or whatever they want to do, raise the retirement age to 80 years old. Or so there's an element of the political sphere that wants to not do anything and to stall and say, hey, there's no perfect solution right now, so let's not do anything. And so that's their kind of game plan, is to stall. But there's others that want to do something. So if your particular politician wants to do something, then tell them you're supporting that particular proposal. So go ahead and subscribe, like, share. And when you subscribe, I'm going to keep you up to date on all that. And if you think your check is incorrect, make sure you reach out to me through the live Q&A here, and let's see if we can get you some more money. All right, so let's go ahead and switch over to the live Q&A. Let's not talk about possible futures. Let's talk about the present right now, present situation out there in the world, and let's see if we can get you all some more money. Thank you for your time and knowledge. You are generous. You're welcome. From Texas. Hey, from Texas. I went to high school in Paris, Texas. So fantastic. Still being hearing from. Yep. I'm here. I'm trying to do a video every single day for at least until kind of near the end of the year. I'm turning 65 in April. When is the best time to apply for Medicare? About 3 months, 2 or 3 months before. But remember, that's one of the unfortunate internet myths out there, that you have to sign up for Medicare when you turn 65. It's partially true. If you do not have health insurance from current work, your current work or your spouse's current work, and your employer has 20 or more employees, then you don't have to sign up. So if you have health insurance, you're happy with it, it's from current work, not the Affordable Care Act, not a COBRA, not a retirement, health insurance. It has to be from current work, and your employer has to have 20 or more employees. If that is the case, then you do not have to do anything at 65. We used to get people to come into my office all the time and say, hey, I'm turning 65 in a couple of months. I just want you to let you all know that I have health insurance from current work. And so you don't need to do that. Don't waste your time. Just go on with your life. If you're currently receiving Social Security benefits, then the procedure is a little bit different, because about 3 months before you turn 65, Medicare will send you your packet in the mail automatically, and it'll have your Medicare card with A and B in there. And if you're receiving monthly benefits, you have to sign up for Part A. It's zero premium, so it's not an issue. But for Part B, you just return the card, or it has other instructions on there on how to refuse Part B. And then, because you have health insurance for work and you're happy with it, and 20 more employees and all that stuff. And then 5 years later, 10 years later, 20 years later, when you stop working and stop receiving health insurance from that work, about 2 or 3 months before you're going to stop receiving health insurance, then go ahead and sign up for Part B. And then you'll also have to find out, what you're going to do to cover all the gaps. There are a lot of gaps in original Medicare. So you either get a Medicare supplement plan or a Medicare Advantage plan. And my partners at Chapter can help you. They're the only ones really in the country that look at every single plan. A lot of people say they look at every plan, but these people actually look at every single plan in your area. That's kind of their go-to, what they're kind of famous for, and year-round customer service and everything. So please reach out to them and they'll help you out. How do I know if I'm getting a qualified Social Security specialist? Multiple specialists gave me different answers to the same questions. Yeah, that's an unfortunate thing. Social Security is at a 50-year low. I hear sometimes 27-year low, 50-year low. The, the Commissioner of Social Security says different things at different times, but I think it's crazy. I've still got people that used to work for me and said, "Ed, we need you back." It's crazy. But all right, so your issue is you call up or you go into the office and you talk to someone about your issue. Who you're talking to basically is a CSR, customer service representative. They're the hardest working, least paid people in Social Security, but unfortunately, they're generalists. They can't be an expert in everything because they need to know a little bit about everything. And unfortunately, sometimes they give information that they are not experts on. And I always told my people, at the front windows, it's like ignorance is bliss. If you don't know, just say you don't know. That's fine. We don't expect you to know everything. Once you set up an appointment, you have to have an appointment for this. So you set up an appointment, and you can only set up an appointment basically in every office in the country is when you actually are going to file a claim, because they're so understaffed. They're not going to set up an appointment for a specialist unless there's going to be a claim coming out of it. You don't have to continue with a claim. You can say, I want to file a claim, go ahead and go through kind of go through the process, and then say, okay, well, now I know what the numbers are. I'll call you back in 2 years when my benefit increases. But you want to talk to, I assume, a T2CS, Title II of the Social Security Act. Those are the people that do the retirement, survivor, spouse, SSDI. That's what I was before I became a manager, claims specialist. So for a retirement, spouse, survivor claim, you want to talk to a Title II CS claim specialist, and then you'll get definitive numbers. And even then, if they quote you an amount, if it's more of a difficult calculation, even then, you wait till you get to the decision letter in the mail for the final numbers, how much your benefits are going to be. 90% of the time, it's pretty easy. But if you have, like, we used to call them scrambled earnings, or your WEP or GPO or something like that, then usually the calculations are a little bit more wonky. So you're just talking to the frontline people, and that's why you're getting different answers. So. Need help bad with Advantage plan. Hey, Kimberly. Yep. So call the number right there, the 352-841-0632. And you might have to be a little bit patient. There's so many people, hundreds of thousands of people that they're getting their Medicare Advantage plans canceled because a couple of the big Medicare insurance companies are cutting back on people. People, if you're living in the kind of the country, rural area, out in the desert, away from a big cities, you just might get a cancellation letter. If you might have already gotten your cancellation letter. So everybody is kind of, going crazy. So you might have to, wait on hold a little bit or call back. I apologize, but this is the most chaotic year we've had in decades. It's unfortunate, but insurance companies trying to make as much money as they possibly can. What are you going to do? Credible coverage question. I'm disabled and always stayed on my husband's plan, but I'm hearing I might be forced to go on Medicare if his plan isn't as good or take a penalty. So you'll have to, if your employer has 20 more employees, it's through current coverage, then you're good. What the credible coverage thing is, there was an issue about that for about 2 weeks. Everybody was kind of freaking out. It was about the Part D, because next year, Part D of Medicare Part D, the max out of pocket switched to $2,000 from $8,000 to $2,000. And there's a lot of private plans that weren't credible in that. So they were going to lose their Part D. But Medicare, CMS, the Center for Medicare and Medicaid Services, jumped in and kind of put a stop to that temporarily. So um, yeah, so that's kind of gone back and forth, but you're probably okay. But I would reach out to your HR, your health company, and yeah, I mean, if the your husband's company just has terrible plans, um, then it might be a good to you switch to over to Medicare anyway, right? If it's that bad. But reach out to your HR, reach out to that particular company and ask them if they're credible coverage for Medicare. Usually that's a big issue for the Affordable Care Act, that, because there's some plans out there that are just terrible, and they pretend to be good and pretend to be health insurance, but they're, just terrible. So those aren't credible. But yeah, just reach out. And then if it's not, then you'll have to go ahead and sign up. If I retire at 70, will there be penalties if I am still working and making over 100,000? Nope, not at all. If you retire at, your full retirement age, if you're born in 1960 or after, your full retirement age is 67. So if you retire at 67, 67, 68, 69, 70, 75, whatever, and you're still working, zero penalties. Make $1 billion a month and won't affect your Social Security negatively at all. Might actually increase. I called today and spoke to Seth and Flor. He helped me out so politely. I'm all set up for next year. Awesome, Megan. Okay, good deal. So you're able to get through the phone. So I apologize for that. I think we got it fixed. I think I'm going to have to switch phone providers on our end, but Chapter has a different phone system, and they're up and running. So call them directly. But Seth, okay, good deal. All right. So hopefully Seth wasn't in the eye of the hurricane there. So glad he helped you out. Thanks for letting me know. I like to keep an eye on our partners here, so make sure they're treating you all right. I am a planning creature. June 2024. Teacher, yeah, teacher, yeah. Teacher returning at 62 with a pension. Plan to move from my state to South Carolina. Are there any new SSA rules I need to be aware of? No. It's a national program. So if you move from Texas to South Carolina, wherever the case may be, it all follows you. You have to make sure that you update your address to Social Security. The only thing, it's not an issue with you, but if once you turn 65, if you move, then you have to find different plan, Medicare Advantage plan, a Part D plan. Yeah. So, but for you, no. But you're a teacher from Texas. So I wonder if did you even pay into Social Security? A lot of Texas teachers have a different system, was it TRS, and so they don't pay into Social Security. So you might have that the WEP, or so let's see here. Linda, how do I check if I'm receiving my deceased ex-husband's Social Security benefits? I'm only receiving one check. Thanks. Yeah, if you're receiving, I did a video on this just to kind of, you technically, if you're getting, let's say, disability benefits and then you file for survivor benefits, or you're getting retirement benefits and then you start to become eligible for survivor benefits. If you're getting retirement benefits and then become eligible for spouse benefits or ex-spouse benefits, those are technically two checks, but they come on the same date and one direct deposit, and people don't realize they're two checks. So every time I do a video on that, two checks, the reason I say that is because they are technically two checks. They come out of two different trust funds. If you're getting disability, that comes out of the disability trust fund, and if you get survivor benefits on top of that, then that comes out of the retirement trust fund, and your disability comes out of your work record, and your survivor benefits come out of your deceased spouse's work record. So those are technically two checks. And the reason I kind of differentiate them like that is because there's so many people that are not getting that second check because they don't know that you can get disability and survivor and all this other kind of stuff. So that's why I kind of say it like that. Technically true, but it's a tad bit misleading because people think they get two checks, in the sense of, one, you get the higher benefit minus your own. So in yours, if you were receiving retirement benefits on your own record, and then you filed for survivor benefits and your benefits increased after you filed, or after your deceased spouse passes, or if your ex-spouse passes away, then that means you're getting the double check. You're getting those two checks. It just comes in one direct deposit. What I would do just to double check is call Social Security and say, and ask them and say, "Hey, I just want to know, and am I receiving my retirement benefits and my disability benefits and survivor benefits?" And they will tell you exactly how much is either. Or you can actually, request a benefit verification letter, and they'll send it to you. And sometimes those aren't very clear. They just tell you you're receiving, X amount of money, and they don't break it down. So you have to ask them to manually break it down. So, but yeah, just call the 800 number when you get a chance and confirm. But yeah, great job, making sure you're getting that second check. Um, Planning to retire from teaching June 2024, move to New York. Okay, New York, just another person moved in South Carolina. Is this a different person? Any new rules I'll be facing in South Carolina? Nope. Again, yeah, same wherever. Will have a pension. Okay. So if that pension is from non-covered employment, that is work you did not pay into Social Security, then yes, that will affect possibly your Social Security check. That's called a windfall elimination provision. Only about 5% of Americans, working Americans, pay into, it's a city, state, county government. The federal government used to have that system back in the early 1980s, but they got away with it. And everybody that works for the government now pays into Social Security, politicians and everything. So, hey, Cadillac Jack. Hey, thank you for sharing your information. I certainly hope they don't cut 20%. I agree. And it's our job to make sure that doesn't happen. So, let's see. My friend on Social Security at 65, she had a nervous breakdown and didn't know she was entitled to fight for her Social Security under disability. Can it be retroactive? It depends. So, you can file an appeal, but technically you have 60 days after you receive the decision. So if she filed for disability, she got the initial decision. It says on that particular letter, she had, they have 60 days, usually 65 days. They allow mail time. Um, and But if it's called a good cause statement. So if this is an initial claim, her appeal would be a reconsideration. So that's form SSA 561. And you just put down there, I disagree. It's a very easy form to fill out. I disagree with the decision. I think I'm disabled, whatever. And then you add another piece of paper, or you can download it's SS 795. Just another piece of paper is fine. And just put down the reason I didn't do with this within my appeal period, that 60 days, is because I had, medical issues, or I didn't get the mail, or whatever the case may be. And if it's, then you can send it up there. When I ran the appeal section of my office, I used to receive good cause statements all the time, and I approved 99.9% of them. So people didn't get their mail, or they, stressed out, or in the hospital, or whatever the case may be. So I'm kind of yeah, I'm an easy touch when it comes to that. So, but if it was like 2 or 3 years ago, then yeah, that might be a tougher one. But it was, several weeks late, or even a couple, 3 months late, they should be good. If not, then yeah, then you'll have to, she'll have to file again, unfortunately. Regarding retroactive Social Security, as the person was homeless until someone helped her a few years ago after to get on Social Security, can it be retroactive under having a mental disability? Oh, the same question here. Okay. Yeah, same type of thing. Yeah, if I've had cases where people have gone into a Social Security office, not my Social Security, another in our city, and 2 years ago, 2 years prior, and the person just sent them away, and they were homeless. And then they came into our office, and we found out the information, found out how they had mental issues, and found out they had gone into another office 2 years ago, and that other office should have taken care of them 2 years ago. We gave that person 2 years of back pay, retroactive pay. So they were able to get, $30,000 or so. So yes, it is possible. So if you went into an office, and it's called a protective filing. I'll be 67 in March. I applied for Social Security benefits online. I'm retiring for the VA in December. What's the date I should put on my Social Security? Should I put, if it depends on, you can go from a, if So you're actually retiring from the VA on December 31st. So you're going to be working the entire month of December 31st. So just put January. Yeah, January. You don't put a particular day. It's just a month. Your MOE, month of entitlement, is January. So you get your first check in February. The January check comes in February. So you're taking your benefits, a couple of months early. You're going to be reduced, a couple of, $5, $10 or something to max. But you're also getting 2 checks ahead of the game. So Social Security told me 135 for spouse benefits. If I wait till April, age 63, I would get an extra 63. I told them holding off till April. Was that smart? Yeah, it really depends on your particular situation. Yeah, if you want to do the spouse benefits, increases every month you wait. You don't have to wait an entire year or anything like that. But if you're able to wait, if you don't need the extra money, because remember, it's 63 extra dollars, but then again, you also get those 2, 3, 4, 5 checks. So you take, $10,000. Let's say you get $10,000 more or something, well, $5,000 more. You just divide, that by $63, and usually comes out to like however many years it's going to take you to break even. Why does the VA not count for insurance at the age of 65? VA medical. Yeah, they just don't. Yeah. But some people, they, because they have the VA clinic, not TRICARE or anything like that. We're not talking about TRICARE for life or any of that. We're talking about just a VA medical. Like, I'm an old Marine Corps sergeant, but I can't get TRICARE, a retirement medical system from the DOD, the Veterans Administration, because I didn't retire. I was only in 8 years. So, but I could potentially be eligible for the VA medical. VA medical, they don't sign up for Part A. So you don't have to. It's your old military. You don't have to do anything in life, but the repercussions are there. So you don't have to sign up for Part B, but if you change your mind later, a year, 2 years, 3 years down the line, then you're going to pay 10% penalty for every 12 months you did not have it. So it sounds like what you're trying to do is avoid paying that $174.70, the Part B premium. But there's a solution to that. They're called Medicare Advantage Part B give back. And there might be one available in your area where you can get your Part B and then not have to pay all of it or any of it, depending on what's available in your area, and then maybe get some extra benefits and all that other kind of stuff. So if you want to see if there's something available for you in your particular area, call my partner there, chapter, and they will help you out. If we don't use Medicare, can we get our money paid in working, get refund? No. Yeah, I wish that would be the case. Let's see. Okay, somebody's answering somebody else's question there. I just started getting disability insurance, and it's been less than 24 months, and I have too much money for Medicaid because I have more than 2,000. Would I be able to get a Obamacare, the ACA? Yeah, that's fine. Yep. I just started, and it's been less than, yeah. So, so once you're on SSDI for 24 months, then your Medicare will start. But yes, if you're waiting for that to start, which I personally disagree. If you get disability, I think you shouldn't have to wait 24 months for Medicare. I think Medicare should start automatically, but that's just, my opinion, and $8 will get you a cup of coffee at Starbucks, I guess, right? Yeah. So in the interim, until your Medicare starts, yes, get the Affordable Care Act. And then once your Medicare starts, then you get your Part A, Part B, and then start thinking about a plan, and we can help you out. I've had appointments. They were set up. They told me there were claims specialists. I have another appointment next week. What to do? Yeah, if you disagree with the decision, if you've been told different things, the level above a claim specialist, there's usually one or two. Where my office was like one of the biggest in the country. We had 4 technical experts, and those are, people that are super claim specialists, and so you can always ask for a reconsideration if you have a particular issue that you're debating. That's fine. And I had one that, wow, hey Deb, she knew everything and then some. Wow, she was awesome. I'm collecting wife is planning to collect sometime around her birthday in September. She has 10 years in PERS and PIM. Um, yeah, so if she has PERS, I assume you mean PSER in PIM. Yeah, I'm not sure. Okay, I'm not going to assume I know what you're talking about there. Let's see here. Nadine, hello. I called Social Security office this morning. They said I would not get both disability and survivor, one or the other. That is 100% incorrect. Yeah. Um, if your survivor benefits are more than your disability benefits, if they're your survivor benefits are less, then yeah, I guess that's true. But if your survivor benefits are more than your disability, so if you're getting let's say you're getting $1,000 from disability, and you're potentially eligible for $1,500 of survivors, right? $1,500 from survivors, but you're getting 1,000 disability. So you'll continue to get your 1,000 for disability plus the difference, $500. So um, if they're so ask them how much the survivor benefit is, and if they tell you any dollar amount more than what you're currently receiving, obviously take into account that you're, maybe paying for Medicare or whatever, but your total benefit amount, if it's $1 more than that, then you're entitled to survivor benefits. And again, it sounds like, come on, Social Security, do some training, a little bit more training for the frontline people. You are eligible for survivor benefits and disability. There's people on here that come to live Q&A all the time, and I'm receiving disability and survivor benefits. I have a question about this. So yeah. And let me see. I wonder if I have you shouldn't have to need the policy reference, but I've got, um, let's see here. I'm looking at the Social Security. There's 20,000 pages of policy. Yeah, yeah. I was gonna put the reference down there, but you're talking to just someone, a CSR, claim this, again, the customer service representative. So um, you need to schedule an appointment. Schedule an appointment for survivor benefits, and then go in there and file a claim for survivor benefits. And as soon as they put it into MCS, which is the computer system there, it'll tell you how much you're going to get. So, and then if they say no, you can't get both, you say, well, I want a letter. I want an official decision of that. And the only way they can give you official decision is if they put it in the computer. And then once they put it in the computer, they'll say, oh, wow, I guess you can get that. And then you tell them you need to go back to school. So anyway, um, I'm a teacher in New York State. I will pay for my employer's health insurance at age 62. Will I be cut off of it, moved to South Carolina from their health? Yeah, I don't. Do I need then? Yeah. So you can't get Medicare until you're 65. So that's not even an issue. So your private health insurance, yeah, I can't help you with that. Husband died, disabled, son disabled, turned 16, filed widows. It's been 2 months and can't make house payments. Say last stage, who do I call? Already did appointment call. Lady doesn't know when it will go through. Um, so it sounds as though the child was receiving just regular surviving child benefits, which is super, super easy. It takes about 20 minutes to file that claim. But then the child is switching to, well, they're only 16, so that shouldn't be an issue. Um, if they were turning 18 and they wanted to continue benefits as a disabled adult child, then yeah, then it takes 4 or 5, 6 months to get the disability approved. But that's not the case here. And 2 months is way, way, way too long. I've done tens of thousands of these particular claims, and they take 20 minutes to adjudicate. So yeah, and considering your particular situation, it sounds like it's time for a congressional, which is go to your federal congressperson, senator's website, and they'll have a little button there where it says, I need help with a federal agency. And you click on it, you fill out the information. They send it to the Social Security in Baltimore, the headquarters there. The Baltimore sends it to the regional headquarters, the regional offices, and it'll get down to your office pretty quickly. And that'll light a fire under them. So yeah, that's not acceptable to wait that long, especially when you really, really need the money. So yes, go to the senator, congressperson, whoever, and yeah, and then tell them All right, here's my little pitch on this one. You know how politicians, anytime they, support a new bridge or a new road or a new dam or something like that, they get out their cute little heart hats and they get their, golden shovels or their big, funny looking clown scissors. And they go out there and they get their picture taken and say, look, I brought this bridge, I brought this highway, I brought this building, to y'all. See how awesome I am? I want those people to go down to the local Social Security office at 9 o'clock when the office is, just now opening, and they see the line all the way down the street, and take their funny scissors down there and say, okay, I brought more staff to this office. I made this more office more productive. Helped their computer system so they could adjudicate claims quicker. I did this, that, and the other. So look how awesome my particular office is and how responsive it is and how they're trained and they give out the right answers and everything like that. And if everybody did that across the country, I could go back into retirement. So please help me go back into retirement. No, I'll keep doing this as long as I need to. Lori, I only take 2 meds. Generics are super cheap. Is it better to just continue paying out of pocket and not submit to insurance so they don't raise my rate next year since I'm not costing anything? No, that's not one of those things. Yeah, no, that's not relevant at all. Where they written, like car, if you have an accident. No, don't even worry about that at all. Because another thing is, next year there's a max out of pocket. So if you're paying any money out of pocket, you kind of have to play it with how your total, drugs are. Maybe right now that might be a cheaper thing to do because you're paying zero, but don't worry about they're going to raise your rates or anything. That's not an issue. But if you do get a medication, it starts getting expensive or something. If you pay for that drug, you just buy it online or something like that, you're not contributing to your max out of pocket. So right now you might be in a best place because it's super cheap and you're not making, it's, but I would check on if it's super generic like that, it might be zero with your plan next year. But again, plans are really, really changing next year. So I would definitely check that out. So when your new plan takes effect January, then play around with those numbers again. And if there's a deductible with your new plan, but maybe those generics don't have a deductible. So kind of play around with it. So, but yeah, but in terms of it's going to raise your rate, no, no relevance whatsoever. That doesn't happen with prescription drugs like that. If I buy health insurance from my employer when I retire at age 62, 20 more employees, yeah, again, 62 is not relevant because you're just talking about retirement. All right. Thank you for helping me with this. I would have been clueless. All right. Glad we could help out. Please make sure, yeah, a lot of people out there need help too. So please subscribe, share, like, all that kind of stupid stuff that we have to teach the YouTube algorithm that people need this information. I think this is one of the best channels out there. Wow, thank you. Dr. Weir, you are so kind to share your knowledge. I appreciate you so much. Thank you very much. Thank you. Yes, don't forget to hit the like button. Lori, teachers do not pay FICA or SSA, but have retirement plans that are supposed to be equal to Social Security. They can stay on the retirement sick. Is that a good idea? Yeah, again, those are all private questions about your particular health insurance. But yes, so you're going to be windfall elimination provision. Betty, on SSDI, 61 years old, Medicare Advantage plan was canceled. Yep, see, there we go. So you don't live in one of the big cities. What it is these big companies. I know what company. There's 2 companies that are cutting back 10% of their members. So you probably live in a rural area, country area, and they just decided they're not going to make enough money off you. So bye. And unfortunately, there's a lot of people, whether these accountants, these bean counters for these health insurance companies say, well, we're definitely not making any money. We're not going to make any money on Betty next year. So bye, Betty. But there might be someone, Bob is, in the next county over, and the same company looks at Bob and say, yeah, you know what? We're probably not going to make any money on Bob, but if we raise a bunch of his stuff, we might just make some money. And so what they do is they keep the monthly premium the same because if they raise the monthly premium, then you'll immediately cancel. But they don't do that because they're smart. What they do is they take Bob's. It's like, okay, we could cancel, but we'll just raise everything. So Bob this year, in case he goes to the hospital, he has to pay $100 a day. Next year it'll be $500. If Bob goes to a specialist, it's $0 this year, but next year it's going to be $35. MRI, 50 to 200. CAT scan, 50 to 300. And then Bob will not check, because that's what the health insurance companies are planning on, because most people don't check to review their plans. Or Bob will just say, well, still 0 premium next year, so I guess I'm good. And then they go on, and then when something happens, they get surprised and they say, what happened? Well, you didn't check, Bob. So Betty, yes, call my partner there, Chapter Advisory, and they will look at every single plan in your area. And the way they work is the people that talk to you, usually when you talk to a Medicare insurance agent or broker, some, they're some get a little bit extra more money enrolling you in this versus this. These guys don't. They don't even, this is the only company, that's why I partnered with them. If the best plan for you is not one they just happen to be contracted with, so the company doesn't get a commission, doesn't matter. That agent, that broker that helps you out still gets paid, still able to feed their family, it doesn't matter which one they enroll you in. Even if the company itself doesn't make any money, that company still pays, the broker, to live. So that's one of the only companies out there that do that. So they are completely 100% neutral in that respect. So that's why I decided to partner with them. So there's that. Yeah. So give them a call and they'll find what's the best for you for next year, and 100% free. And the new plan will start January 1st. Your current plan is still good until December 31st. So don't forget, if you have any, kind of money in there, like in a dental or vision or anything like that, make sure you suck all that money out of there before December 31st, because then it goes bye-bye. So yeah, there's that. Hello, in July, I applied for divorced spouse benefits and had my phone appointment, but yet haven't heard back from Social Security. July, wow, this is becoming a terrible trend, isn't it? Yeah, you need to reach out. I would call the 800 number and find out the status. And then if you continue to get the runaround, just do exactly what I mentioned. Do a congressional, and I think that might be as all the congressionals that we do to get this stuff done. At the very end of it, it says, hey, I applied for, divorce spouse in July. I still haven't got the money. What's going on? And by the way, what are you doing, Senator so-and-so, to improve customer service in your local office? That is your jurisdiction. That is, right down the street from your house or whatever the case may be. This is an office in your state, in your congressional district. What are you doing? I don't care about the rest of the country. I just care about, my backyard. What are you doing to improve that customer service in your Social Security office? So I saw you put on your funny hat with the funny scissors and stuff, but yeah, get to it. So I'm going to be very popular with politicians, aren't I? So anyway, Patricia, should I start getting my Social Security now or wait till July 2025, 66 now? Concerned that Social Security Congress might do something to hinder me and others. What's your suggestion? Yeah, so I just talked about that. Again, I'm optimistic. I think us as American people, we're gonna, we'll get them to do the right thing. But if you think that's not the case, then you just might want to go ahead and get your benefit. People ask me all the time, generally, should I file earlier? It depends on your health, depends on your family longevity. Do you need the money? Are you working over the annual earnings limit? Is getting the extra money going to put you over in terms of tax, put you at an upper tax bracket, or whatever the case may be? So there's a lot of variables to determine whether you should get your benefits now or wait. So nobody can tell you. And there's too many people on the internet and social media says, if you don't get it at 62, you're dumb. If you don't wait till 70, you're dumb. And just everybody that says that is dumb, because it's all particular situations. You ask yourself those 5 or 6, 7 different questions, and everybody is different. So I am still deciding if I want Medicare Advantage or Plan D and N. Do I need to know when I sign up for Part B if I want Advantage? I am 66, I already have Part A. Want to start Social Security, Medicare? No, you still, yeah, you go ahead and sign up for Part B, and that's not an issue. And you still have time. I make no secrets. If you can fit it within your budget to have that monthly premium for a plan, Medicare Supplement Plan N or Plan G, I always recommend those because you got no prior authorizations, you got no networks, so, but a lot of people unfortunately can't, fit that extra monthly premium and the Part B premium in their budget, so they go to a Medicare Advantage, which is fine, rather than just having Part A and Part B. That's definitely a terrible idea. But you should have a Medicare supplement or a Medicare Advantage. If you get Medicare Advantage, you just have more work to do, by keeping up on it and pushing your insurance companies if they delay, something, or yeah. So, and then reviewing your plan every year. ACA doesn't count your resources. Correct. Income based only. Correct. Yep. But you have your B64 under. Then at 65, you can't be on ACA. Then you have to be on Medicare, and they count your resources. Makes no sense. You can actually be on ACA, the Affordable Care Act, after 65, but you lose the subsidies, in terms of the cost sharing, and you lose the advanced premium tax credits. And because that's not credible coverage for Medicare, you're going to be penalized for 10 months or 10% for every 12 months you did not have Medicare. So you can keep ACA, but yeah, nobody does because of those two things. Yeah, I paid zero on ACA and yet Medicare 174. Correct. Because yeah, once you're eligible for Medicare, then you lose those ACA subsidies. So if you go back and check your ACA now, then your ACA is probably going to be, $200, $300, $400, $500 because you've lost all those subsidies because you're eligible for Medicare. I have a lady friend. Okay, here we go. I like this. We always like it when people say, hey, I've got someone down the street I'm helping out here, who was married 13 years, then divorced. She'd never remarried. He did. Doesn't matter. And she is 63 on Social Security. She gets little. Can she get more from exes? Yes. She says maybe nothing from her state, PA, Pennsylvania. Yeah. Yeah. If the ex spouse's benefit amount, full benefit amount, the full retirement age, called the PIA, primary insurance amount, if it is twice her full benefit amount, then absolutely she's entitled to those benefits. She was married for over 10 years. It doesn't matter whether the ex has been remarried, doesn't affect, they won't even know. And it doesn't matter whether the ex is filed, as long as the ex is at least 62 years old and they've been divorced for at least 2 years. Doesn't matter if the ex spouse has filed. But if the ex spouse has already filed, then that 2-year divorce thing is not relevant. But yeah, I would have her call Social Security and find out if there's more money there, in the sense of the ex's benefit amount is twice hers. So what you do is you have her call Social Security, and if she has the Social Security number, fine. If not, no big deal. Then all you have to do is, if you don't have the Social Security number, you just give the person's the ex's name, the date of birth, as well as the city, state, as well as they know it. They'll find the Social Security number, and they'll tell you whether there's any more benefits. They won't. People always say, they didn't give me the Social Security number. No, they're not going to give you a Social Security number. They didn't tell me how much I was going to. Yeah, they're not going to tell you how much it is. They're going to say, yeah, there's more money there. Let's set you up an appointment. And then you have to go down there and you provide your marriage certificate and divorce decree, and then they'll tell you numbers. So yeah, they're not just going to start blabbing off numbers, and Social Security numbers. Yeah. So people get mad at me. They didn't give me the Social Security number. Yeah, no, they're not going to give you the Social Security number if you didn't already have it. Not if they go ahead, the next generation of who runs the country. We can still hope for a change. Yes, I'm always very crazy, stupid, optimistic. Does each state allow different things, or the same all states benefits? Yep, all the same. The only thing that's kind of different is common law marriages. So common law marriages, some states allow common law marriages, others don't. But yeah, other than that, for Social Security benefits, it's pretty much the same. Medicare, same. Medicare plans are all different based on states and zip codes and everything like that. Are taxes automatically taken out of Social Security payments? No, but you can have taxes taken out. It's called the Form W-4V, voluntary tax withholding, at 7%, 15%, 22%. So, yep. All right. Yep. Penelope. Hey, Penelope. All right. Penelope is always jumping in there and answering the questions, and she has been 100% right so far. So, thank you, Penelope. How long after you file for retirement benefits do we have to wait after the interview, time wise? If it was an easy claim, I've taken hundreds of thousands of those. And if there was no scrambled earnings or, have to check your green card or anything like that, it was just simple. You know, by the time you stood up and walked 5 feet to the door, your claim was adjudicated and done. So that's how. But if the person that took yours was a trainee, then they're under, for the first couple of years, basically they're under 100% review. So that case has to be reviewed by one of the technical experts to make sure it's accurate. That's part of the training process that takes 2 years. That's why, um, that Social Security is 50-year low in staffing. If Congress woke up tomorrow and said, "Hey, we really need to do something about customer service so Ed can go back into retirement," we'll give Social Security a whole bunch of staff. So, hey, offices, you can hire 50,000 new employees. It won't make a difference. It actually worsen customer service for at least 6 months or so, because those people have to be trained, and other people in the office have to take time out of adjudicating claims to help train those people. And so, but after about a year, then customer service will be super, super awesome again, and you will get correct answers, and you will never see me again. Um, my wife wishes that every day. But anyway, if Social Security takes away 20%, I will not be able to make my rent or bills. I am 69 and disabled. Yes, and you and millions and millions and millions of other Americans are dependent wholly on Social Security alone. So, Deborah, what I want you to do is reach out to every single politician. You got 2 senators in your state, and you have one congressperson that represents you in your particular district. So call them up and say, what are you doing to make sure that doesn't happen to me? And number two, what are you doing to improve customer service? Go get your funny scissors. All right, I'm getting angry. Is the only way to find definite dollar amounts through the computer with a specialist? Yes, yes. And anybody else, you don't know 100% for sure until you receive that decision letter. For easy retirement claims, they'll put you in the system, they'll do the application right there, and they'll tell you the numbers right there. For like something like survivor benefits, it's kind of more difficult calculation. So, usually they have to take that back to their desk and, kind of do the calculations, and then you'll receive the letter. But the definitive one is once you receive the decision letter. So, Stephen, did you say that there would be 7 to 20% cut in Social Security benefits in 2024, or is this based on news article, not the Social Security Administration? That is based on the Social Security Administration with the Department of the actuarial, the head actuarial guy, Stephen. Oh, forget. It wasn't Steve. No, it's not Stephen. I made that's your name. I think his name is Stephen too. But no, that is the official numbers. The 17 to 20%, it'll be 20% if they don't consolidate the disability and the Social Security, the OASI trust fund together, which is the Old Age Survivors Insurance Trust Fund. That one is really, really short. The Disability Trust Fund is actually good for a long, long time. So if they take that money and consolidate those two, then it'll only be about a 17% cut. But if they continue to separate those, then it'll be a 20% cut. So yeah, that is an official. You can go onto the website, the actuarial and congressional testimony, Martin O'Malley. Yep. I also do not have any living family members anymore. 5-year look back for SSDI. If you have 0 credits and for the 5 years you get 3 credits each year, would you qualify for SSDI if the 20 credits are earned over 6 years? Okay, so what the look back, what he's talking about is DLI, the date last insured. In order to get SSDI, Social Security Disability Insurance, it's insurance, so you have to be insured. That means you paid into the Social Security Administration for 40 quarters, 10 years. If you're younger, less, but if you're 50, 60 years or so, you had to pay 10 years. And then you also have what's called what non-luck is asking about is the date last insured. So 5 out of the last 10 years, you actually had to be working. So the idea is you have to think about it like this. This is the way I explain it. If you worked in your 20s and 30s and you paid into Social Security, you're now insured for Social Security disability insurance and retirement benefits and everything, right? But then you took the next 30 years off and you traveled the world, and then you got disabled, jumping off a cliff in Mexico or something like that, and you came back and say, "Hey, I can't work anymore. I'm disabled." And they're like, "You haven't worked in the last 30 years. So you're not insured anymore." Once you hit your full retirement age, or once you hit 62, you can file for retirement benefits. That's fine. But in terms of disability benefits, you haven't worked 5 out of the last 10 years. It could be any 5 out of the last 10 years. It doesn't have to be consecutive or anything like that. And so, yeah. And that's a calculation because there's so many different variables in there when you became disabled and everything. So I would get an official decision if you're wondering whether you are currently insured. So I would file a disability claim and have them run the calculations, and they will let you know whether you are currently insured. All right, let's see. My ex and I were common law in Texas for 6 months and married. So yeah, so that's um, th- I'm pretty sure in Texas that means you were dating. And so if you were married and divorced, um, yeah, then if you actually got married, that means you got married. So it wasn't a common law. If you lived, for 10 years together as husband and wife, but you just got never married and never divorced, then that's a common law. But again, all states are different. And I know Texas is strange, but I don't think that's the case. So you can't do common law and then get married because you were married. But um, the Social Security Administration, it still has to be 10 years regardless. The Social Security Administration, they have in their policy, in those 20,000 pages of policy, they have the specific state laws for common law and what you have to prove. So just file and they will go through it and see if that counts, but I don't think that counts. Getting son 16 disability check, took mine, so I filed for widows, paid too much. Okay. All right, we're running out of time, and let's see. Let me get some people that I don't think I've ever seen here, so we'll get some new people. I am super paranoid about this, as already have my request in. Any advice would be appreciated. And let's see, what will people do if all the Medicare Advantage plans go away and you can't afford traditional Medicare? I don't think the Medicare Advantage plans are going to go away. Not by because the health insurance companies are making way too much money on those things, um, and therefore they're convincing politicians with all that money to keep those around. Actually, there's one political party that wants to make Medicare Advantage the default. Once you sign up for Part B, they automatically put you on a Medicare Advantage plan. Yeah. Um, so I disagree with that. But all right, let's see. Bill, I don't think I've seen Bill here before. What's up? My wife's 62 on Social Security, but uses Obamacare. Plus, we use dental and vision. Do you help with this? I have a group out of Texas there that helps with the Affordable Care Act, but only in certain states. I think they're like in 17 states right now. So click on that little QR code there and click on the little thing that says under 65 health insurance, and I've got a list up there of the states they help with. But if not, then yeah, just keep on keeping on until she hits 65 and gets that Medicare. I'm on SSDI. I was told that I can't apply for survivor benefits until I'm 60. Well, yes, that is the case. Yes, nobody can get survivor benefits until they're 60 years old, unless you are eligible for what's called a disabled widow's benefits. Disabled widow benefits from 50 to 60 years old. You can get disability benefits on the deceased spouse's record, which is called disabled widow benefits. But if it's someone you divorced from or something like that, then that is correct. 60 years old. I live in Santa Clara County. Medicare Advantage Canceled. Santa Clara. That's huh. That's kind of where well, Santa Clara is a little bit further away from the big city, but yeah, there's big enough population. I'm surprised they canceled the Medicare Advantage in that particular plan, that particular area. So yeah, you'll need to find something else. So yeah, call that number unless you already have an insurance broker that can help you out. But if you don't, give us a call. All right. Penelope is awesome as always, jumping in there. Don, can I switch from an N to a G or G to an N without overwriting during? You can do that 365 days of the year. For that, for a Medicare supplement, you can switch those plans all year long. You don't have to wait. But yeah, you still have to go through health underwriting unless there's some type of special enrollment period you moved or something like that. But if you're healthy, you can, switch from a G to a cheaper G, from an N to a G, from a G, and from an N to a cheaper N, or whatever the case may be. Um, and those people that, Neil and the other people that have been canceled out of their Medicare Advantage plans, if you receive when you receive that letter that your plan is canceled, that gives you one of those special enrollment periods. So if you always said, "Oh, I should have done the Medicare supplements," so I don't have to deal with these networks and all this other stuff. Now you do have a special enrollment period, so you can enroll in those. So if it fits within your budget and everything, then yes, you a lot of people are very happy they've been canceled. I got people that I certainly hope I'm canceled this year. I wish they would cancel my plan so I can switch back to original Medicare and go on a Medicare supplement. I live in New York City. How will the Advantage plan affect us in this area? Yeah, I don't think they're going to be canceling any plans in New York City because they make tons of money there. But, just like, these are profit driven organizations. They're, next year's plans are probably, you need to check all the fine details. Not just everybody just looks at, oh, next year the premium's the same. Okay, bye. Go on with my life. No, you got to check everything else. You got to check out, the dental decrease, did the hospital stay increase, the CAT scans, the blood testing, X-rays, all that stuff increase. And if it did, maybe you need to review your plan and see if there's anything better for you for next year. So, all right. We are over an hour, and I apologize. Got a lot of questions there still. I will be back again tomorrow, and I'll do a topic of the day. I'll make it as short as possible. So if I didn't get to your question today, I apologize. Cut and paste your question. Join me again tomorrow, same bat time, same bat channel. Put your question in as soon as I start it, and I guarantee I will